I just want to let my director know, Candy, she does not want to be on TV, so do not air this woman on TV, okay? Whatever you do, I just don't want you to put her on TV. She doesn't want to be on, okay? Okay, thank you very much. Cosmetic surgery doesn't always have to be as heavy as you think. We sent our videographer, Patrick, out to take a look at some quick and easy fixes. Please watch.
Cosmetic surgery. A lot of people are reluctant to have it because they feel it's invasive and expensive. Well, today we're going to find out that's just not the case. Dr. Mulholland, what are we going to be doing today?
Well, Patrick, what we're going to do today is just show people that there are many things that can be done very simply and very quickly and get you back to work in a matter of minutes and can address some of the blemishes that really bother people.
What are we going to be looking at first off?
Well, what I thought we'd do first is look at one of the most common blemishes, which are spider veins. Spider veins of the legs. And they happen, usually it's hereditary. Unfortunately, genetics plays a large role, but pregnancy, weight gain, weight loss, all those can affect the reflux of blood into these little spidery guys. And the treatment options include needle-based treatments or a laser. And today we're going to do a laser. So I'm applying cooling gel to keep the skin protected and to keep all the laser energy right inside that specific area. This here is the head that we use to treat. This is the leg vein laser. So I point at the particular lesion in question and fire. We point at the particular lesion in question and fire. And we do several treatments until we see it disappear. Now, how many times does it take? Everybody asks that question. Well, if you're lucky, it may only take one session. Most people need 2 or 3 treatments separated by 6 weeks to get a really nice result. And unlike sclerotherapy or the injection-based treatments, she doesn't need to wear gauzes or support hose. She can head right out onto the street and away she goes.
Dr. Mulholland, what are we looking at here?
Well, this particular blemish, Patrick, are accumulated pigmented lesions is the medical term, but really they're just sunspots, age spots, and liver spots. They can be on the back of your hands, usually on the face or the shoulders, and up the arms. And we tend to like to think they go away after summer, but usually they don't, and they get more numerous and larger in size. Fortunately, we have a simple outpatient treatment with the ruby laser that I'm just going to dismantle right now. Right. It can be done in under 5 minutes, and again, under $500, and you can go right back to work. I just put the laser housing over top, and we fire away, and it forms a little white crust. See that little white crust? And when that crust comes off in 3 or 4 days, about half of the lesion will be gone. And it'll be a little bit pink, easy to camouflage, and that pinkness will last about 2 weeks. And at the end of about 3 or 4 weeks, this pigmented lesion will be completely gone. So unlike the leg veins and the spider veins, these is usually a 1 treatment session. It's also good for tattoos. It's good for certain birthmarks and moles. And you can see how much of an improvement you get just with 1 treatment.
Wow.
Oh, yeah. I'm so glad. Dr. C. Mulholland is here. Glad you're here. We love him. I'm glad to hear you say that you can remove tattoos, because I look at some of these younger women and I think, boy, you know what? I don't think you're going to be happy with that whatever on your whatever when you're in your 30s. So that's good news.
It is. It's amazing. It's been a huge explosion in the acquisition of these tattoos. And now they come in and suddenly Bob is Dave or Dave is George, and the tattoo has to catch up with the person.
Did you hear about Johnny Depp? He used to go out with Winona Ryder, and they broke up. It was a terrible breakup, and so he had Winona on someplace on his body, I won't say where, and he had some of the tattoo removed, and it says Wino now. So I mean, you know, whatever you can do. Now let's go back to the spider leg veins, because I had that done a little bit, and great results. But this is not something. It's not like one-stop shopping here.
No, particularly spider veins, but all these blemishes, we don't really get rid of the cause of them. If you're going to go out in the sun and get exposure to sun, you'll get brown spots.
Yes.
Hereditary, gravity, pregnancy, a lot of factors give you spider veins. But what we can offer is a quick fix for the blemish itself. Now, you may develop more in a year or 2 or 6 months. You may need to come back.
Sure.
But we can certainly make the lawn look well manicured, even if the roots are still there.
Okay, now let's just talk about with the spider veins. You go in for 1 visit. What is it, 20 minutes to half an hour?
Yeah, 15 to half an hour, depending on how many spiders you have and how much you want to treat on that particular day.
Okay, so how much is that?
15 minutes is about $150. Half an hour is $250.
Okay.
And you can treat virtually your whole leg in a reasonable situation where you don't have too many spider veins in about half an hour.
Okay, so that's going to obviously take a couple of visits to probably get done, because
Yes.
we're never happy with just, one visit. Now, when, as far as the pain threshold, I mean, everybody has a different pain threshold.
Absolutely.
But, I noticed very little pain. But I also was told, too, you have to be careful what time of the month that you go.
Yeah. You can't get very sensitive towards the time of the period and menstrual at the end of the month.
Yeah.
And some people they can tolerate discomfort, and some can't. So there's real variation, and the laser nurses are very, very good and quite sensitive to those needs. And so they will recommend coming at a certain time if you have difficulty at the end of the month.
So expect some minor pain no matter what.
It's not as painful as a needle, but it still hurts.
Yeah.
Achieving what you want to achieve hurts.
Yeah. Beauty hurts, doesn't it? It sure does. Okay. One thing I want to make mention, too. What about these brown spots on the hand? You're talking about this woman. By the way, I loved how she was laying on the bed, because I was like this on his bed, like this. Okay. What about brown spots that start appearing on our hands?
Yeah, the brown spots on the sun-exposed areas are a very common problem, and people may do a lot of facials and look after their face, but they forget about the hands.
Yeah.
And the hands often look 80, and you may look 40.
Right.
And those little brown spots, and even some of the wrinkles and the veininess, can be treated with some outpatient techniques. And the brown spots can do very, very well with this laser.
Does that hurt too?
Not as much. It's not a sensitive area. It's not like sometimes the legs are very sensitive. The back of the hands is not very
I would
sensitive.
think that it might be because it's all bone there.
You'd think so, but it's just, if you map out the sensory receptors, it's really quite widely spaced on the back of the hand compared to other areas.
So it's a little bit of salve maybe, just in case?
Yeah. Sometimes we can put some numbing cream on if people are having problems.
Before you do it?
Yes.
Absolutely. Okay. All right, what we'll do is we're going to take a break, and Dr. Steve Mulholland will join us in the next break. And I want you to get your questions ready, because we'll talk about anything you want to talk about when it comes to cosmetic surgery. Stay with us. We'll be right back. Good.